দর্শক আমন্ত্রণ জানাচ্ছি চ্যানেল 24 এর সাপ্তাহিক আয়োজন মুখোমুখিতে। মুখোমুখিতে আজ আমরা কথা বলবো ওয়ার্ল্ড হেলথ অর্গানাইজেশন হু এর কান্ট্রি রিপ্রেজেন্টেটিভ ডক্টর বর্ধন জং রানার সাথে। ওয়েলকাম টু দ্য শো।
Thank you very much.
It's been a busy month for you since you arrived because the exodus is here and a lot of people, a lot of crisis. Everyone having a health crisis. Someone is having major health crisis, someone is having non-minor health crisis. There are a lot of pregnant women, single mothers. You're having a lot of pressure. So how's the months for you?
Well, it's been 6 months now. So from the beginning, it has been a run for trying to catch up with the things. Anytime such a big, huge, I mean, not even big, it's really huge, influx of people coming in. Health has always been a major issue.
Yep.
These people who came across, their immunization status, their health status, had not been as good. So when they came over, we started first signs of seeing some cases of measles. And immediately, I think we were the first one to start giving them vaccination against measles and polio, because we realized that they haven't had these things earlier. Everybody was not in the same level of immunization status. Following that, we had another round of measles. Then we had vaccination against cholera, followed by which there was an outbreak of diphtheria, an unheard of disease which has already been in the past. So we had to immediately bring in a lot of experts of diphtheria and respond to it. Did a vaccination campaign of diphtheria. 2 rounds have already finished until now. The 3rd round is starting on March of 10th. And we also gave this vitamin A along with it. So these things have been really up there running after the diseases so that this don't have an outbreak. So we have been fortunate that with this amount of people, we haven't had a really major outbreak. There was a small outbreak of measles, then the diphtheria came in, but all this has been controlled. So we have been really, really busy trying to put this there. Yes, there are other things that are there as well, which you just mentioned. There are maternal child health issues, mental health issues, non-communicable disease issues. These are things that we need to tackle. And we are working on that at the moment as well, side by side with responding to the outbreaks. So
Right.
it
Sounds like you're not sleeping.
We are, you could say that. You should talk to some of our staff in Cox's Bazar. They are running full time.
So when these people came from Myanmar, they're like very unhealthy. They don't have good health facilities where they live. So they didn't have good nutrition or sound nutrition or anything. They had a lot of crisis. So what are the crises in coming months you're going to face, or you have in your prediction, because rainy season is about to start at April?
Yeah. That's been the worry of everybody, not only WHO, but I'm sure all the organization, humanitarian partners who are on the ground. Rainy season in Bangladesh is not simple drizzle. It's going to really pour, and you know better than I do. And we've also know there might be a hurricane and cyclones in that area, because that's the belt as well. So we are all very worried about this. From the health side, yes, we are already thinking about a number of things that can happen. One is the influx, the increase in the waterborne diseases.
Yeah.
Right? And then also with that water will come the vector-borne diseases. So these are a few things that are really going to be strong. We are already preparing for all those things, how to tackle these new things, new infectious diseases that might be coming. Besides, they are now here 6 months. They have their own regular diseases. They have people with diabetes, the people with hypertension, right? Then, like you just mentioned, and they just mentioned all the childbirth that are going to take place. So reproductive health. So yes, these are things we're really going to face. So everything is now on preparation. By the way, and mental health. I did mention about mental health as well, where these people have had the trauma, and also still going under trauma and not being able to live in their own house. So we are all working in all these angles. In a non-communicable disease, communicable disease has always been there, mental health, water and sanitation. These are all areas in front that we are working on to ensure that they remain healthy.
Okay. On this discussion we'll come back but before that we have to take a break.
Thank you.
দর্শক, আমরা কথা বলছিলাম WHO কিভাবে কক্সবাজারের রোহিঙ্গাদের স্বাস্থ্য নিরাপদ রাখার চেষ্টা করছে প্রত্যেকটি মানুষের। এখানে নানান ধরনের সমস্যা আছে, প্রত্যেকটি মানুষের প্রত্যেকটি সমস্যা ভিন্ন সমস্যা, কারো কারো ক্ষেত্রে এক সমস্যা, সবকিছু হিসাব করে তারা এগিয়ে চলেছে। আলোচনার এই পর্যায়ে একটা বিরতি নিচ্ছি, সাথে থাকুন, ফিরছি একটু পর। আমন্ত্রণ আর একবার মুখোমুখিতে। আজকে আমরা কথা বলছিলাম WHO এর বাংলাদেশ কান্ট্রি রিপ্রেজেন্টেটিভ ডক্টর বর্ধন জাং রানার সাথে। ওয়েলকাম ওয়ান্স अगेन। As we've been talking about the future, let's more talk about the women and child health issues. What are the crises you have faced? Because there are nearly 50% or 60% of the whole population came after this massive accidents over there. It's women and child, and a lot of them, nearly 52,000 women are like pregnant, if I'm not wrong. Correct me if the data are wrong. So these are very specific issues and sensitive issues, and you have to sort of look at them sensitively and take care of them sensitively. So what are the plans regarding them? What you have done, and what is your future thoughts?
Well, for the child, basically, as I mentioned to you in the first section, they have been given immunized. Now they are fully immunized as such, and we are now slowly going to move into a routine immunization, strengthen that and keep that as to ensure that all children have the complete immunization. The immediate threat of measles and diphtheria were taken care of, and polio and cholera that was taken care of, and that will continue. For the mothers or the women, the vaccines also apply to them for measles as the elder people as well. But if they're pregnant women and women who are coming with childbearing age women who are there already, they need special care. Right. Then what we are doing is we are strengthening our reproductive health and maternal child health section, which is going to be more intensified as we come along, because the initial threat of any outbreaks were taken care of. That's very important, because we're going to save lives. Now we're going to looking into all these other aspects of a routine, like I told you about routine health of their regular monitoring, going to health centers and so forth. So we're working with the government very closely to help them have
how you're reaching all these women? Close, by door to door, or you're reaching through a community clinic?
Through community clinics.
Okay.
Through community clinics.
And that's funded by you or for somebody else?
That's funded both by government and partners and health partners. WHO has very little on direct intervention on this. WHO's main intervention has been on outbreak response and saving lives immediately and so forth, and also doing a lot of surveys, EWARs as we call it, early warning, to know if the disease is going to happen, which is very, very important. Right. So the surveillance part, to know what the community is, the health of the communities, where they are, what are the likely diseases that are going to happen, what is the health status, all these survey, including the survey for the water quality, that's right, what we're doing. Right. So we're doing a lot of survey side, as well as response side by vaccination and responding to any outbreaks by case management if the cases happen, which we have done a lot, helping NGOs, INGOs set up their case management centers, emergency medical team centers, and all that. So that's what we're doing.
So how you're securing the water, because it's just next to the sea. Yes. And safe water is sort of a big challenge, right?
Safe water is always a big challenge in a place like this when there's a huge community coming and living in one place. I'm sure the government has done a lot in the beginning, but even the government did not expect this big to come. Yeah. Nobody expected this big to come. So in the initial stages, I remember they had put in, you put the latrine in one place and the water drinking in another place. And you think about, okay, where it should be. It should not be closed. It should not be contaminating each other. But as people kept on coming, you just keep on keeping places, and you have to have water, you have to have bathrooms. You just had to do the whole thing. So yes, that's been one of the major concerns for everybody. And when the monsoon comes in, the water will dilute things more. The chances of getting contaminating gets higher. So that's what I told you the other time. It's waterborne diseases are really an issue that we can turn. So we are already looking into all those, trying to prepare the community, trying to prepare the health centers, giving them guidelines, training, capacity building to ensure that they can manage cases that are coming for waterborne disease cases, and then the vector-borne disease cases as well. So these are things that we're really putting a lot of work on.
So on this point of discussion, we have to take another break. We'll come back and talk about more of rainy season and challenges. দর্শক, আমরা কথা বলছিলাম WHO বাংলাদেশ কান্ট্রি রিপ্রেজেন্টেটিভের সাথে আলোচনার এ পর্যায়ে একটা বিরতি নিচ্ছি, সাথে থাকুন, ফিরছি একটু পর। আমন্ত্রণ আরও একবার। আজকের মুখোমুখিতে আমরা কথা বলছিলাম রোহিঙ্গারা যারা কক্সবাজারের বিভিন্ন ক্যাম্পে আছে তাদের স্বাস্থ্যগত দিক, ঝুঁকি এবং ভবিষ্যৎ নিয়ে, এবং কদিন পরেই বর্ষার মৌসুম শুরু হবে। সেক্ষেত্রে WHO, জাতিসংঘের এই সংস্থাটি পুরো বিশ্বে সকলের স্বাস্থ্যের উন্নয়নের জন্য কাজ করে থাকে। তাদের যে প্রস্তুতি সে বিষয়ে আর এ বিষয়ে কথা বলার জন্য আমাদের সাথে আছেন WHO বাংলাদেশ কান্ট্রি রিপ্রেজেন্টেটিভ ডক্টর বর্ধন জাংরানা। Welcome to once again. It's been a really challenging for you in the coming days, when especially the rain will start. So what are the major 3-4 challenges you've been sorted out by working in last 6 months?
Well, you're right. The rain is going to be a big challenge, not only to the health sector but every sector. I already mentioned that to you. Everybody is now coming together. We are doing lots of meetings, coordination in how to face this and the preparations for this. This includes the government. Government is very much aware of this, and they're as worried as we are as well, how we are going to tackle this. Few of the things that is already ongoing and the preparations are already started are like mapping of the camps, where now the camps are being mapped. So which are the areas that is going to get really bad when flooded? We've got, agencies and humanitarian partners, and the governments have already brought in engineers and specialists to say, like, okay, here are the areas that's going to be really bad. At the moment, we're seeing more than 25% that might be really affected. It could be more, depending on how the rain and the cyclone comes.
Where is this 25% located?
Within that, it's there. It's mapped. Right?
Within, okay.
If you look at a map, you'll see where the things are. At the same time, there is a lot of negotiation and talks with the government trying their best to support, is trying to find them where they can relocate some of these people to.
These 25% people.
And these people and some others, so we can also spread out, and the congestion can also be taken care of. So there are works going on in that line as well as a lot of camps will be flooded as well. So there are talks with the government right now, with the partners, and government has been very positive about the idea of resettling them in a new place. So they are looking into those areas so that the congestion in the present camp gets slightly less, as well as the effect of the flooding does not happen to everybody. Beside that, it is also we are also looking into health centers being made ready for any likely diseases that comes. Like I mentioned earlier, waterborne diseases, acute watery diarrhea, which could happen in a big things, especially when there's the water and sanitation issue. So all these centers are now being ready and being prepared to handle such and manage such cases, along with the vector-borne diseases, malaria, dengue, chikungunya. These are all the things that are being ready to handle that.
What's your observation on the government and the ministries?
I would never be able to say if you said that they're doing this for the first time. It has been an amazing response by the government. Maybe it's because of it's a refugee crisis, or people coming in across the border. Maybe it's because the Prime Minister is very dedicated and has given her full support. Maybe it's because of the humanitarian feeling that there was initially, as you must have seen, the host community really responding to this. It has been an amazing response, and government has been commendable to do this. Not only me, every donor partners out here and humanitarian agencies have been very happy and pleased with the response that the government has given.
But do you think, including the government, with all UN agencies, are all of you missing the local communities and the crisis? Are they being ignored?
No, never. If you look at the JRP's population, if you see the first page of JRP, it says 1.3 million.
Yep.
That's not what the Rohingyas are. That's more than the Rohingyas. That is including the host community. Even the JRP has taken that into account. WHO has taken that into account a long time ago. Because, you see, for health, for a virus, for a bacteria, it doesn't know this is Rohingya or this is a host community.
Right. Thank you. It's been a really pleasure talking with you. It's been a really good experience. I believe WHO will work as it used to work for people in the Cox's Bazar. And any last message you want to share with us?
The last message is that we all have to get prepared for the monsoon season. We have been working very well. Health has been very well coordinated, and the partners in health so far has been responding amazingly. We have been able to, almost say control the outbreaks that could have taken place if we hadn't done so. The monsoon is done as effectively and as quickly as possible, but we are all keeping our faith that all things will work fine. And we have to thank the government, and because they are also on this same mission, and they are very much part of the planning process that is taking place and the preparation that is taking place for the upcoming monsoon.
Thank you so much. It's
Thank
been
you.
an absolute pleasure.
Thank you. My pleasure.
দর্শক, আমরা কথা বলছিলাম WHOর বাংলাদেশ কান্ট্রি রিপ্রেজেন্টেটিভ ডক্টর বর্ধনজং রানার সাথে। তিনি বলছিলেন আসছে বর্ষা মৌসুমে বাংলাদেশ সহ জাতিসংঘ এবং অন্যান্য দাতা সংস্থা যেভাবে রোহিঙ্গাদের মানবিক চাহিদা রক্ষা একসঙ্গে কাজ করেছে, যদি তেমনভাবে কাজ করতে পারে, নিশ্চয়ই বর্ষা মৌসুমের সকল চ্যালেঞ্জকে মোকাবেলা করা সম্ভব। তবে এজন্য একটি সমন্বিত উদ্যোগের প্রয়োজন। দেখা হবে মুখোমুখির অন্য কোনো পর্বে।